KWOC News Time, 8:07. Welcome to Brittney on the Bluff, brought to you each weekday by Today's Computers, Whitworth's Gift Chest Jewelers, First Community Bank, and Key Drugs in Poplar Bluff. Ladies, boy, do we have a topic for you. Something extremely important. Yeah, you're already guessing it, aren't you? And we're going to be talking about your health today. Amber Christian, Marketing Manager with Poplar Bluff Regional Medical Center, in the studio with us this morning. How are you doing?
Oh, I'm excellent.
Glad
Thanks for having
you could be with us. And Donna Mansard, I did get that right, didn't I?
Yes, you did.
Oh, good. She's the Assistant Administrator of Poplar Bluff Regional Medical Center. That's a pretty important job, too.
It's a busy one, but very, very fulfilling.
And rewarding, right?
It is, very much.
Definitely. Well, we're here to talk about Pinktober.
Yeah.
Pinktober. I love the name, and I love this idea of reminding ladies about making sure that they're doing their breast exams, their mammograms, all those important tests, because, of course, October is Breast Cancer Awareness Month. All across the country.
Yeah.
Probably around the world, actually.
And breast cancer awareness has become, a really big thing in the last 10 years or so, and our hospital is trying to do our part. If people have driven by the hospital at nighttime right now, you know that we are completely lit up with pink light bulbs.
They're decked out, man.
Yeah.
It's so cool looking.
It is very pretty. So we've gotten a lot of positive feedback from that, and we're taking it one step further. We're also giving out Pinktober kits at Danny Bell Cancer Center and at the Bluff Imaging Women's Center the entire month of October. Basically, just walk in and tell them you want a Pinktober kit, and in that kit you'll get a pink light bulb for your own front porch.
No kidding.
We have pink wristbands, car magnets, cooler cups, just all kinds of fun little goodies in there to help support breast cancer awareness and pinking out Poplar Bluff, which is a big thing these days. I know UCAN has been working on that pretty strongly, and so we're helping support them, and then also helping to raise awareness for breast cancer and the importance of doing those self-exams and also getting your mammograms. So along with that, we have another event that we're doing the Wednesdays in October, and you can call Bluff Imaging Women's Center. You can set up a time to come in, and we have a physician there who's going to do a breast exam for you, and then also show you how to properly conduct a self-exam. And we're also doing bone density screenings along with those services. So if you want to go pick up your Pinktober kit, maybe you can give them a call, set up a time to get a breast exam and learn how to do self-exams. Pick up your Pinktober kit. If you haven't got your mammogram, you can go ahead and make your appointment there for that also. Of course, as we do every year, we give away a gift to every lady who has a mammogram in October, so we've got that going on. So there's just a whole lot happening.
It sounds like it.
Another big thing that we've got going on is our tailgate party. Most people in Poplar Bluff by now know about the Poplar Bluff Mules Pink Out game.
Yeah, this coming weekend.
Yeah, it's this Friday, and we've joined up with the Mules Booster Club to host a Pink Out tailgate party at the Chamber of Commerce parking lot on Friday at 5 o'clock. We're going to get started. We've got music and hot dogs and hamburgers and drinks, and we've got face painting, and we've got a cool pink-themed photo booth, and it's just going to be a whole lot of fun for the entire family. And get you revved up to cheer on the mules, and also you can pick up your Pinktober kits there. And we've just got a whole lot of fun stuff happening on Friday at the Chamber of Commerce parking lot before the game to get everybody amped up.
Sounds perfect. Just up from the football field, so very
so
convenient.
You can park and walk over to the tailgate party, get yourself a soda and a hot dog, and just enjoy the atmosphere, and then head on over and cheer on the mules. I think kickoff is at 7 o'clock.
I was kind of afraid you were going to say you were going to have all pink food, and I was thinking, what could you serve that would be pink? Let's see.
Well, if the food's pink, the Booster Club was in charge of it. So.
We'll blame them. Huh?
No, I'm just kidding. They've been really great to work with, and we appreciate them greatly. So
definitely be a part of that, and it's free.
Yeah, it's free of charge.
Party?
Just stroll up and get yourself a hot dog and soda, and like I said, just get amped up for the game and get your Pinktober kit, so whenever you go home, you can pink out your house and just we'll have education materials. We're going to try to have some of our physicians out there to talk to some ladies about, different women's health issues. And it's just going to be a whole lot of fun. The kids are going to have an amazing time because, like I said, face painting, we all know how popular that is. We've got stuff to do, ribbons and little horseshoes and all kinds of fun stuff. So it's going to be a good time.
Hey, that sounds like a great time. It's starting at 5 p.m. on Friday.
Yes, that's correct.
At the Chamber of Commerce. So mark your calendar so you don't forget about it. We'll try to remind everybody a little later in the week as well. But, let's talk about the whole breast cancer thing because, that is, as far as the pink being used to raise awareness, I think it's working.
Yes,
and I think
definitely.
it really is working. Even when you see, football teams and basketball teams and, different organizations and stuff promoting it by the wearing of the pink and having the pink jerseys and pink ribbons on their helmets and things like that. It seems like everybody is at least thinking about it.
Exactly, and I want to encourage everyone, regardless of age, to start doing those self-breast exams, and certainly women at 40 and older should be getting those regular mammograms. Early detection is the key. The mammograms aren't as bad as they seem, so I encourage everybody to get out there and have one. Also, I just want to put in a plug here for our cancer center. The Danny Bell Cancer Center, we're very proud to share that we have all of our services now consolidated to the Westwood campus, right off of Westwood Boulevard, where the hospital main campus used to be. And we have our radiation oncology center there. Dr. Mary Hebert is a new radiation oncologist with us. We have a new radiation treatment machine that allows us to treat tumors more precisely, and we can do anything here that they can provide in the larger cities. We also have our ambulatory infusion center where patients receive chemotherapy and our medical oncologist on site. UCAN also recently moved on site with us, so we have them there. Wow. Yes, we're really excited about that. Melody and her team are there, and they're able to help patients in our community and in the surrounding counties with gas cards, transportation needs, medications, things like that. So we immediately connect our patients who need that assistance with UCAN. American Cancer Society are also very engaged in our program. So again, just want to share with everyone that our goal is to provide all of those outstanding cancer services right here in the community so that patients can stay close to home, close to family while they're going through those things. But again, just one more plug, get out early, ladies. Do your self-breast exams and get your mammograms. Early detection is key. We can beat cancer if we catch it early.
That's the big thing right there, and that's the key to success in many cases is just that early detection.
Exactly.
So, you mentioned the Danny Bell Cancer Treatment Center. It wasn't that long ago where people in Poplar Bluff had to go to St. Louis or Memphis or sometimes even farther away to receive the treatment that they needed for various types of cancer.
Right. We've recruited a lot of new physicians to the community as well. We have 2 new medical oncologists there on site with Dr. Hebert. Dr. Parmanathan, Dr. Marionis are there as our hematologist, oncologist. Hematology is blood cancers, and then, of course, the oncology are the other cancer types. But all of them work very collaboratively with our other physicians to manage the cancer for our patients and to fight it and hopefully win that fight against cancer.
The breast cancer thing, that's one of the highest numbers of occurrences with women in the country, isn't it?
It is. Actually, our top 4 cancers in this region are breast, colon, prostate, and lung. Breast in most regions is always in the top 4 cancers. But again, it's very treatable if detected early. You want to catch it before it spreads.
That's what the self-exam thing is all about.
Yes.
Is trying to, of course, you need that annual checkup every year to get that done. But in between that time, if you're doing your exams, your self-exams on a monthly basis like you're supposed to do, if something does happen to develop, if something starts happening, you're going to know about it.
Right. The more you do self-breast exams, the more you get to know your body also. A lot of women have the fibrocystic condition where they have cysts that you may be fearful that might be a cancerous lump.
Right.
But you don't know unless you go to your physician and you ask, if you feel a lump, please go in, be seen, and find out if it is something you should be concerned about or not. It's very important.
Absolutely. And ladies, I understand. Trust me, I understand that not wanting to go do it. It's not a fun experience. It's just not one of those that we look forward to. But like she was saying, if something does develop and it's caught early enough, there's a very high rate of success with breast cancer these days.
Yeah.
So how far have we come, say, in the past 20 years as far as breast cancer goes?
Yeah, I think we're eradicating a lot of cancers. We have the treatment that we have to fight cancer now is amazing, and I think more so now than ever before, we're able to successfully treat cancers, particularly if caught early. The new forms of radiation that we have are truly amazing. They allow us to administer a much higher dose of radiation and to be able to navigate around the critical organs in the body and to try to limit the damage to the healthy tissue but target the cancerous tissue and kill it.
One of my coworkers here in the radio station has had breast cancer, and she was telling me about these little, I forget the term, isotopes maybe? I'm not sure. She was using a term that these little bitty things, and she said, and they can put it directly where it needs to be to try to kill the cancer without destroying all the tissue around it.
Right.
How cool is that?
Right. And
that was one of the big things 20 years ago.
Exactly. We've come a long way. Technology is amazing, but also the early methods for early detection, the mammograms are continually getting better. The imaging, it's a lot of it's 3D, 4D, so the physicians have the capability
4D.
of seeing images a lot more clearly, which allows them to more clearly detect. Of course, they have the genetic testing now, where if you have a history of breast cancer in your family, you can do the genetic testing and determine if you might be someone who would be likely get breast cancer or would have a likelihood of getting that at some point in your life, and then you can determine options before it happens to try to prevent it. But I also want to invite anyone who would like to tour the Danny Bell Cancer Center. Please call the Cancer Center, and it's 686-3700. We would be happy to take you on a tour, show you our new radiation treatment machine, and even introduce you to the new physicians on our treatment team.
Well, you mentioned, and you said it so quickly, but you mentioned prevention of finding out. Can we prevent breast cancer? I mean, I had not heard that we actually had prevention methods.
Well, there are many cancers that are preventable. A lot of breast cancer is genetic, so we cannot control sometimes if we're going to get it, but you can control most health conditions, including many types of cancers, by eating healthy, exercising, just doing the things that we all should be doing in our everyday lives to remain healthy.
Anyway.
Avoiding exposure to chemicals, things like that. Pesticides, there's a lot of spraying of crops and things in this area, but just doing all of those things to try to be healthy in our everyday lives is what we can do to try to prevent those types of health conditions.
Should we be paying that extra money for the organic fruits and vegetables as opposed to the traditionally raised?
I can't really speak to that. That's really up to each person's discretion. I personally like the organic because they're grown without the chemicals, and of course the chemicals can cause adverse health conditions, but again, that's really up to each person's discretion.
Well, let me ask you this. The reason I bring this up, I was listening to a program earlier, like last week, and there was a relatively young woman that was on a tirade against microwaves. And, I remember when I was a kid and my parents got their first microwave, they would tell me, don't stand so close to it, stand back, because they were worried about there being some sort of, radiation or something from that. And this young lady here all these years later was basically kind of afraid of the microwave. Is that something that people should be concerned about these days?
I honestly can't answer that.
It's one of those
I'm not afraid of my microwave.
I'm not either. But then you look at some of the numbers of increased, the increase in cancer and that sort of thing. something's causing it. You know what I mean? Something's
Well, I think
out
there are a
there.
lot of different things that have the potential to cause cancer,
Sure,
and I think
sure.
we're all fearful of how we could possibly get cancer because cancer is a terrifying diagnosis, and I think we're all afraid of it because I think all of us have been touched by it. Either a family member has been diagnosed with cancer or a friend. We all have had loved ones who have been affected by cancer or who have had it. So
Absolutely.
I mean, again,
yeah.
I just encourage everyone to try to lead a healthy lifestyle and avoid those things that we know are bad for us. And then I think that's the best we can do.
Well, you know, the monthly self-exams is such an essential thing, but unfortunately in today's busy world, sometimes ladies kind of forget about it. And I had heard maybe last year, I think, during Breast Cancer Awareness Month, a little tip, and I went, oh, what a great idea. And that is for ladies to get a couple of their friends, and each of you get it on your calendars and call and remind each other when it's that, you know, do it all at the same time a month and call and remind each other, because you know how it is. You know,
Exactly. We're all
you're busy ladies,
Well,
and
KFAS 12
you know?
has a big campaign around that too. They do the Pink Up the 12th day of every month all year long, and they also kind of encourage, you know, hey, if you don't have a day you're doing yourself breast exams, we always advertise our Pink Up on the 12th. Do it on the 12th. So
It's just they'll help remind you.
yeah, so whatever you can find to help you remember is great. I mean, a lot of us have medications and things that whenever you go to get your prescriptions refilled, when you call in that refill, do your self-breast exam.
That's a
You
good
have to do
idea.
that every month.
And
So-
we all have cell phones. Put it on your
I know,
calendar
that's
as a
what I have had to
reminder. It's the
resort
same
to.
date every month.
That's what I've had to resort to, is putting it in that calendar, in that little phone. Beep, 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 tells me, hey.
But you know,
do your
ladies,
exam.
we are the best one to know what's going on with our bodies. You know, if something isn't quite right, you need to question that, and you need to go see your doctor and just do that follow-up and have those checkups, because, you know, things can happen so quickly, and it's okay to ask for a second opinion. If you go to a physician and you're still not comfortable, you're still not feeling right and are concerned, get a second opinion. That's very important.
Absolutely. And if you, well, like I actually had cancer a couple of years ago, and I had some, I call them symptoms, even though technically the cancer I had wasn't really supposed to have symptoms. But I just think it was God making me go to the doctor. That's what I've said all along.
Heads up, something's
Because I'm not,
right.
he knows me. He knows that it's going to be pretty bad for me to go and get it checked out. So, and I had been to several different doctors, and hadn't really gotten the answers I was looking for. And I had gotten to the point, and I'm not proud of this, but I had just gotten fed up, I'll be honest, and I had quit going, because I felt like I was kind of wasting my time and money, you know.
Right.
And one of my coworkers here was emphatic and wouldn't let me give up. And she said, look, we know you. We know something's not right. Don't give up. Don't quit going. And so finally went to the right person,
Right.
and, you know, got the right tests and found out what was going on, got it taken care of, and everything's fine.
Well, and I think most cancer survivors that you talk to will tell you that. If something doesn't seem right with your body, you need to get that checked out. That's a key to prevention of all types of cancer. It can be something as simple as, a urinary tract infection that won't go away. Well, that might be something else. It can be
Right.
nausea, dizziness, tiredness. All these things are your whole body is linked together, and whenever something's not going right in one part of your body, it's going to affect other systems. And so notice those things and don't ignore them. I think that's a big message from every cancer survivor I've ever said.
Absolutely.
If your head hurts more than 4 days in a row, you need to get that checked out.
Right.
It's
Well,
not,
I had
don't ignore those things.
convinced myself that I was crazy or something, or I was a hypochondriac.
Oh, no.
You know, I was just, because everybody I taught, all the physicians I had spoken with, couldn't find anything wrong.
And you know, the physicians, though, they're all very well trained, but the one thing that every one of them will tell you is they are human, and
Oh, absolutely.
and no physician can know everything.
Absolutely.
And
my symptoms were such a common thing.
Yes.
It could be literally a million different things causing that.
And
it's not that I
sometimes-
blame them.
And sometimes
But-
it takes multiple tests and different things
Right.
to diagnose you properly. And that doesn't mean that the physician's not doing what he or
Right,
she
exactly.
is supposed to do. That doesn't mean that the test wasn't beneficial, but sometimes you have to do 4 or 5 different tests to rule things out and really get to the root cause of your symptoms and your problem. So you just have to keep going. Even though it becomes difficult and it becomes frustrating, you have to keep going, working through that process to properly diagnose what's going on with your body.
Absolutely.
It's very important.
Well, and I've heard numerous physicians say that medicine is a science, but it's also an art form.
Yes.
You know, it's noticing, hey, that doesn't look quite right. Let's try this. That doesn't
Right.
look quite right. Let's try this.
Well, gosh,
So,
and everybody's body responds differently to different illnesses as well.
Yeah.
You know, so, you know, we may have the same disease. We could all three have the same issue, but we could all be, our bodies could be exhibiting it in different ways.
Exactly.
So how in the world, I don't know how doctors do it.
yeah.
I honestly, there's no way on earth I could even come close
and
to doing
cancer
that stuff,
always
you know?
starts somewhere. I would encourage everyone to, the ladies out there who might not have a history of it in their family, to still question it. If you're having
Absolutely,
symptoms, if you're
yeah.
having issues, even though you've not had anyone in your family who has had breast cancer, please don't take that for granted. Get checked and try to find out what is actually happening.
Absolutely.
And hopefully it's not breast cancer, but you don't know until you ask. And to me, peace of mind is worth a lot.
Oh, me
Yeah.
too. Me too. I've got a friend that, bless her heart, it's just like trying to pull nails to get her to go to the doctor for anything, let alone when she's feeling fine. You know what I mean?
Right.
To do like to do her mammogram and pap smear and stuff like that. I'm just like, go do it. Well, I'm fine. I don't feel. You don't.
By the time you feel
know.
it, it's oftentimes too
Exactly.
late. In fact, we have a insert that we put in the paper on Sunday, and in this insert it talks about early diagnosis and keys to success in breast cancer treatment. And it's got a wonderful illustration of the average size of the lump found by a regular mammogram is 1/8 of an inch. So you can imagine, very, very tiny, very, very
Yeah.
tiny. The average size of a lump found by a woman who doesn't regularly perform breast exams is 1.5 inches. So that just illustrates
Wow.
how important. You may not feel that anything's wrong until that tumor is 1.5 inches wide, and then you know,
Wow.
maybe it's spread, maybe it's in your lymphatic system, and you know, it might be too late. So don't just sit around and say, well, I feel fine, so I'm probably fine, because you might not be. You know, we can get that pea-sized lump out, get you some treatment, and send you on your way, or you can have that 1.5 inch lump and be in a very serious position with your health. So yeah.
Wow. I'm going to remember that and tell her that. 1/8 of an inch, 1.5
Here,
inch.
got a handout.
Oh, man. I'm
there.
telling you.
And it is scary. By
Is
the
it on
time
the-
you
okay.
feel it,
Cool.
it might be too late.
That
Not
is-
too late, but it might be to the point where it has already spread, like Amber said. So it's extremely important that you go in and have those regular mammograms, because a mammogram is going to detect something that you can't feel.
Right, right. So, I mean, really, when you're doing your self-exams, if you feel anything, you need to call your doctor immediately.
Immediately. Yes. Yes.
Don't put it off.
Yes.
And, you know, I've heard of cases of breast cancer specifically where something happened and all of a sudden it's growing at such an increased rate that it becomes a very frightening situation.
Yes, there
So-
are a lot of different types of breast cancers, and actually a lot of people don't know that cancer itself is actually several hundreds of different types of diseases, or what we categorize as cancer. So there are along that line, there are several different types of breast cancer, and so depending on what type of breast cancer you have, it could grow at a very slow rate or it could grow at an accelerated rate. And once you're properly diagnosed, your physician would help you determine, you know, which yours is and what the best course of treatment is to attack that.
Yeah, and our physicians are doing a lot of genetic testing now for that. There's a BRCA1
Yes.
Mutation in our genetic code that is indicative for, higher risk of breast cancer. And so now if we have all of our breast cancer patients get that testing to see if they have that gene, and if they do, then they take preventative measures to, if you only have it in one breast, let's go ahead and do a mastectomy on the other breast so that you don't end up with it, because the likelihood of recurrence in those individuals with that genetic mutation, it's the genetic mutation that everybody's talked about that Angelina Jolie had.
That's what I was going to say.
Very high incidence.
What she had.
So now all of our breast cancer patients get that testing, which is, all of the breast cancer patients at our facility anyway.
Well, they
get that testing.
Yeah, they certainly have the option. I think the medical oncologists present the option to the patient, and then it's up to each patient's, discretion whether or not they want to get that or not. And then they can determine with their physician best course of action. Not everyone is going to go to the extreme of having a mastectomy or a partial mastectomy. It may just be that they're more closely monitored, knowing that they're more likely to develop breast cancer during the course of their life. So every patient's situation is different.
Oh yeah. Well, what are the instances of women having breast cancer, getting treatment, and then having it return? Is that something that women that have?
Well, that depends. That really depends on a lot of different things. The efficacy of their treatment, the thoroughness of their treatment, wherever they get it.
Right.
How thoroughly the tumor is targeted and eradicated. It's depending on the type of cancer, a woman might have a lumpectomy or a mastectomy, and what the pathologist always try to do is to get a negative margin of tissue, which means that after they remove the tumor or the breast, that they have a margin that shows no sign of breast cancer whatsoever. At that point, then they determine if they're going to do chemotherapy, radiation, or a combination of the two. And I think the effectiveness of that treatment for each individual patient will determine whether or not, and at the stage at which they are diagnosed as well, will determine how well they do. If a cancer has already done what we call metastases, means that a cancer has spread in the body. So for example, if you're a breast cancer patient and your cancer has metastasized, that means it could have gotten to your bones, to your brain. I'll just share a personal story. My sister actually at age 46 died of breast cancer. We had no history of it in our family. So this is something I'm very passionate about, because a year before she was diagnosed, she found a lump in the underside of her breast. She had the mammogram. The radiologist, it was in another state, guys, the radiologist told her it was just a cyst, though. And she had the fibrocystic condition, but it was actually a cancerous mass, because it was a year later that she started exhibiting more extreme symptoms, went back into her doctor, was diagnosed with breast cancer, and that was the primary site of her cancer. At that point, it had already spread. It was in her bones, and then eventually spread to her brain. So I share that because she had a great cancer treatment team. She had, even though she was stage 4 when she was diagnosed, which is the most extensive stage for cancer, she had 10 great years after that, because she had such a great cancer treatment team. She received the chemotherapy and the radiation. So even though you're diagnosed with a higher stage of cancer, there is still hope. You can still have a great quality of life. It's just critical that they seek out high-quality cancer treatment and very high-quality physicians to administer that care. And then how well a person does after treatment really depends on that person, the stage at which they're diagnosed, and the treatment they receive. So it's very difficult. You can't say that, you can't really state that in general that everyone will do well if they do this or they do that. It's really varies by person.
Individual. Very individual.
Yes.
I was about to ask another question that you would tell me it's very individual, and that was, it seems like, years ago, women, when it came to the mastectomy and that sort of a thing, there was such a negative attitude about it, because the woman's sensuality is connected to her breast and that sort of a thing. Do you see a change in women's mentality, at least?
Definitely.
In this?
Definitely. There's so many things that women can do. There are the breast prosthetics that you can put in the bra that gives the external appearance of onlookers that, that we're just
They'd
fine.
never know.
And it just, women we're very much about our image, and I think our self-esteem is very driven by our outer appearance. And so that we're very sensitive if we have to have a lumpectomy or a mastectomy. And so you have the prosthetic as an option, but, women also have the option now of the reconstructive surgery. And with reconstructive surgery, it's not, it's not evident at all that someone has undergone that, and that I think has really helped women's self-esteem, those who have had to have those radical mastectomies. I think the reconstructive surgery options have really been helpful.
And I think a lot of insurance covers now reconstructive surgery for breast cancer
They
patients.
do.
If that's a choice that the patient would like to make, then
they do.
usually it's typically covered by your insurance.
Well, that's good.
Yeah,
that's
which
good.
is amazing. Yeah.
Do you think that the women that you see in the media and that sort of a thing have kind of helped relieve some of that pressure as well, like Angelina Jolie? I mean, I don't think there's probably anybody that would argue that she's not one of the sexiest women on the planet. I mean, she's been considered that for years, and then for her to make that choice and be so public about it.
Definitely. Well, she's showing women not to be so focused on their outer appearance, that your health should
Number
be your
one.
prime
Should be more important.
focus. She has children. She wants to live a long life to be with her children, and I think it helps put our priorities in perspective.
Kind of helps a little bit, doesn't it?
It does.
Don't feel quite so
It's less
alone.
stigmatized.
Yeah.
It's more socially accepted to say that, whenever it comes to my looks, I would like to look nice, but that's not the most important thing. Being here for my children and my family for the long term is more important than
Absolutely.
outer appearance. And I think that that's a good lesson that we could all learn, regardless of whether we're talking about mastectomy or not.
I think so too. Well, you had mentioned that you're going to be doing these screenings and teaching women to do their self-breast exams and that sort of a thing. And you mentioned the the bone density test as well. Is there a connection between bone density and breast cancer? Is that why you're doing those two tests?
I don't know the answer to that question, but osteoporosis
just kind of a woman thing,
right? Osteoporosis affects women. A lot of that it has to do with level of hormones, but also because we give birth to little lovely babies, and that depletes our body of our calcium stores. Yeah, it sure does. That's why you're supposed to go to the dentist while you're pregnant and all that good stuff.
Sure.
But anyway, so that's just another thing that we are able to throw in. We have a great screening tool for bone density. It's a heel scanner. You take your sock off, and they put some ultrasound type gel on your heel. You stick it in this machine. It gives you a reading, and the reading will tell you whether or not you should talk to your doctor about your bone density and possibly get a more extensive DEXA scan, which is a service that we offer. It's a full body scan. You lay on a table and you get your bone density, and I think it focuses primarily on the hip bones. Kind of looks at those and it sees how dense they are, if they're starting to get porous and that sort of thing, and so you can treat osteoporosis. So it's kind of just another little women's health thing that we have at Bluff
I had never really
Imaging.
heard of a connection between those two, but I thought, well, maybe there is.
I
Maybe
don't know.
that's why they're offering them
to that
together.
very well, but we're just offering it.
We're offering
cool.
it
It's a
because we're
great thing.
focusing on women's health in the month of
Yeah.
October, and so that's another great test that we should all be getting.
And while you're at the Bluff Women and Imaging Center, it's easy to do. It's a 5-minute test.
Oh, yeah.
Just stick
Totally
your heel in that
non-invasive.
machine. Yeah,
No
not
pain
invasive
whatsoever.
At all.
Very easy.
And our staff is really well trained on doing those bone density scans. We do those a lot of health fairs and things. So it's not a diagnostic tool, but it's a tool to say, okay, there could be a problem. And so it's just useful to have. And if you're going to run into Bluff Imaging and pick up your Pinktober kit, learn how to do a self-breast exam, you may as well get that bone density checked out too.
Especially since it's a freebie.
Yeah, it's free.
How often do you get that?
Exactly.
Well, we talked about the connection between breast cancer and genetics. There's definitely a family history kind of issue involved in this. What are some of the other things that we're discovering about breast cancer? Have we determined that there's like environmental factors that we're seeing are tied to breast cancer numbers? Anything like that you know of?
We keep hearing about hormone therapies and stuff and birth control pills and all that stuff, and I think that is kind of like on the edge of do we know whether that's a thing yet or not? I don't know, but it can't hurt to research those things and just figure out for yourself what you think is a good idea and what's a safe idea and what's not. So I think it's a little bit I don't know that there's a whole lot of conclusive evidence out there that says if you did this, you will have this. But there's a lot of research going on that if you're curious about those things, if you're worried about them, get online and go to WebMD. Try not to look at every website because you don't know what's reputable and what's not.
Right, yeah. I encourage everyone to talk. A pretty good one.
I encourage everyone to ask their gynecologist those questions because the gynecologists are the ones that are prescribing the birth control pills, the estrogen, those kinds of things, and they stay informed of the most recent research and what those indicators are. I can't really speak to that intelligently, but I would just refer them back to their physician for that information. I know that's something I'm very cautious of. Obviously, having a sister who had breast cancer, I do all of my regular mammograms and monitor those kinds of things. I've not had the BRCA test, but that's something I'd like to do in the future. But just encourage women to ask their physicians those questions and make sure that they stay aware of that as much as possible. I can't say that it's really from an environmental cause as much as I think it's probably genetic. But again, I think we need to talk to our physicians about those things.
Well, we've seen such an increase in the number of cases that, you know
why that is, though. We're detecting it earlier.
That's what I was just going to say. Or plus the population's growing. When the population grows, you're going to see more numbers.
We have much better detection, though. Better health care, improved technology. We have, and that's true of all cancers. We are just doing a much, much better job of catching cancers earlier, and so the incident rates seem to be increasing, but when in actuality, we're just doing a better job of detecting the cancers early.
I mean, there was a day...
50 years ago, you wake up one day and you're sick, and 3 weeks later you may pass away, and everybody's like, oh, we don't know, they were sick, and
that's what I was just going to say.
You go and you get your mammogram, you detect a lump the size that's 1/8 of an inch, you get that taken care of, and you've officially been diagnosed with cancer, which puts you into that statistic pool is where before, somebody passes away and they're an older person.
And you may never know what they died of.
No, you may never know what exactly happened.
Well, is there an age where you're too young to start considering these things? I mean, should mothers be teaching their teenage daughters to do breast exams and that sort of thing? Or
every mother is going to be...
What is the suggested ages and such?
Well, different mothers are going to be comfortable or less comfortable perhaps with doing those things, and so I have to defer to that individual. But again, what I would suggest they do is to talk to their physician about the appropriateness of talking to their daughter about those different things in the appropriate age. Me, myself, I have a daughter who's 20, and that's something I started talking to her about when she was in her teens. Of course, she saw her aunt go through what she did with breast cancer, and so she's very mindful of that. But I've seen patients who are in their young 20s who have had breast cancer, and so no age is too young, and particularly if there's a history of it in the family, I think you need to be talking about it, and you need to be aware and watching, not fearful, but just be informed and know what the warning signs are, and certainly, as we've discussed, do those measures to detect breast cancer early if you are more at risk.
What is the suggested age to start having an annual mammogram these days?
At 40.
It is still 40?
Yes.
Okay, I didn't know if that had changed.
Different organizations have been trying to extend that a bit. And again, that really depends on your family history. If you have a family history, like I do, I started getting my mammograms at 35 for that reason. And so again, it's really, each individual needs to be talking with her doctor about that and determining the appropriate age at which to have that done. But anyone of any age can have a mammogram. They need to do that based on feedback from their physician.
Absolutely. Well, ladies, we need to take a quick break, but we'll be right back to talk more about Pinktober, Breast Cancer Awareness Month. That is this month. Ladies, Talk to your daughters. It's important stuff. We'll be right back with more Brittney on the Bluff right after this on today's Talk, KWOC, 9:30 a.m. and 93.3 FM. KWOC News Time, 8:51. Welcome back to Brittney on the Bluff, brought to you each weekday by our fine sponsors. Today's computers, Whitworth's Gift Chest Jewelers, Key Drugs, and First Community Bank in Poplar Bluff. We've been talking about Breast Cancer Awareness Month, Pinktober, as we're calling it, at Poplar Bluff Regional Medical Center. And ladies, let's run through some of these specific things that are happening this month. I don't want anybody to miss out on the opportunity for the free screenings and that sort of a thing. And we've got some specific dates, so we need to mark calendars. So tell us a little bit more about Pinktober.
Well, the big screening events that we're having are on Wednesdays in October.
Okay.
And we're setting appointments for those because we have one physician that's helping us out with those screenings. It's a female physician, one of our new hematologist oncologists. Her name is Dr. Kavitha. Her last name is Parmanathan, but I think a lot of people are calling her Dr. Kavitha. So she's very down to earth and laid back, as you can imagine.
Seems a bit of a challenge to me.
Yeah. Oh, and she's just the sweetest, nicest, most soft-spoken lady you could ever imagine. So she makes people really, really comfortable. It's very nice to have her working for us and with the hospital. But anyway, she's conducting breast exams at Bluff Imaging Women's Center on Wednesdays. You need to call them to set up an appointment. The number is 573-785-6610. You'll call and you'll talk to them and set up an appointment. She'll do a breast exam. She'll also then kind of show you how to do a self-exam each month. So that's kind of nice because we don't really, you can read a little pamphlet that tells you how to do it, but whenever you see a physician do it and they show you how to do it and coach you and say, yes, that's exactly right, or no, you want to push harder, or whatever the case is, that's comforting, of course.
Sure.
And then we're also doing the heel bone density scans, and that's just a screening mechanism, much like a self-breast exam, that kind of can give you an indication of whether or not you may be having any issues with bone density and whether or not you need to explore that and see how you're doing overall. So that is every Wednesday in October, and then the number is 785-6610. Also, we're giving out the Pinktober kits with the pink light bulb. There's a pink silicone bracelet kind of a thing, a car magnet, a day planner, some resource material about breast cancer and breast cancer awareness. There's a koozie cup, just lots of fun little promotional type items in that pink bag. And you can pick it up at Bluff Imaging or at the Danny Bell Cancer Center. You just walk in and say, hey, I heard about Pinktober kits and I want one, and they'll hand one over. And we encourage you, if you do get those, go ahead and put that light bulb on your front porch and help us pink out Poplar Bluff.
That's cool.
And then what else? We've got the Pinktober tailgate party this Friday at the Chamber of Commerce at 5 o'clock. We're just going to kind of get amped up for the game, do some awareness type stuff, do face painting for the kids. We're going to serve hot dogs and hamburgers. We're going to have music out there. It's just going to be all in all a fun time, and it's a nice thing to do before you go to the game. Like you said, it's really in close proximity to the stadium. It's at the corner of Westwood and Business 60 right there at the Chamber of Commerce parking lot. And we want to thank the Poplar Bluff Mules Booster Club for letting us help them out with that this time, and kind of work in the awareness factor into their regular tailgate party. So we do appreciate them. So come on out, you can also pick up a Pinktober kit there if you don't have time to run into Bluff Imaging or the Cancer Center. We've got lots of fun stuff. Pink footballs, face painting. I think they're going to have some of the pink You Can shirts on sale, so if you haven't gotten yours yet, you can go ahead and buy it and then go to the game. And I know that the game is always, I've been a couple of times, and it's always, there's a little more excitement around the game. It's a little more people. Everybody's decked out in their pink. There's a lot of raffles and different things go on. The players typically kind of dress up. My daughter is in choir, and they're going to sing, and usually the cheerleaders have the little girls out there and do something for
cool.
for this game. So it's kind of it's a fun game to go to. It's not just your regular Friday night football game. So if you're not really into football, you can still go, and it's going to be a good time. Yeah.
And the weather's supposed to be better by then.
Oh, well, I hadn't looked that far ahead. So
Yeah, the weather's supposed to be better Friday night, mostly clear.
Let's hope so.
And
We've had
50.
enough rain.
Oh,
Yeah.
haven't we though?
I'm
And I
looking
think
at the
it's more
forecast
today.
now. It actually is showing Friday sunny and 75.
Yeah.
Oh, yeah. So all you need is a light jacket for that late night football game and come on out and enjoy hot dogs and hamburgers and drinks and music and all the fun stuff we've got going on.
I like the pink footballs.
Yeah. We
I might have to come by and get a pink football.
Yeah, definitely do. Definitely do.
Oh, well,
The
ladies,
kids will love it.
I
Yeah.
sure appreciate you coming in and talking with us today about such an important issue. And again, for those ladies that, for whatever reason, maybe it's something that's happened in their past that makes them a little gun shy about this or whatever. Those ladies that have never done their mammogram, never done their self-exams, they're kind of the head in the sand kind of crowd.
Mm-hmm.
What would you say to those ladies just a couple of minutes before we get out of here today?
Grab a friend. Go with a friend to have your mammogram. If you're afraid to go have it alone,
That's a good idea.
the buddy
Yeah.
system always works. So that way you can support one another, help one another deal with your, face your fear of the mammogram. And I think you'll see that it's a very simple test.
Yeah, it's not.
It's not painful. I've had it
Yeah.
done regularly now for many years. I'm not going to tell how many, then I'd be telling my age. But but ladies, it's truly not bad. But you know, if it helps you feel better about it, grab a friend and go together.
Yeah.
And also our staff at Bluff Imaging, they're just, top notch at making women feel comfortable whenever they come in for something like this. It's you have a nice changing room. It's a beautiful atmosphere. The technicians that conduct the mammograms, they understand people's nerves and they talk you through it in a way that makes you feel better. So, if you're reluctant to go, just have that peace of mind that our technicians are specially trained to deal with those fears and those trepidations, and grab a friend and get on out there.
And ladies, yeah, it's not comfortable, but it's not that painful. I heard for years before I ever went and had my first one about how bad it hurts. And then after the first one, I was like,
It really doesn't.
what's the big deal, man?
Yeah.
It's uncomfortable, but it's not that big a deal.
Takes about
Childbirth's
10
a lot
minutes.
worse, isn't it?
Definitely.
and-
It takes about 10
And
minutes.
if you put
Yeah,
it into
it's-
perspective,
yeah.
having a
Discomfort
positive
for 10 minutes,
diagnosis
die.
at a later stage in
Exactly.
cancer is going to be a lot more uncomfortable than having that quick
Very true.
quick mammogram each
Yes.
year.
Very, very true. Ladies, again, thank you.
Thank you.
so much for coming in and talking with us today. We sure appreciate it.
Thanks.
That's it for Brittney on the Bluff for today, but we'll do it again tomorrow right here on Today's Talk, KWOC.
Informative, entertaining, and free.